Warm greeting. Today I am going to speak with you regarding the next exam with mock test. I am Dr. Sunil Nathamaske, working as a dean in Dr. Vithalrao Vikhe Patil Foundation's Medical College and Hospital Ahmednagar in Maharashtra. In last one of the YouTube video, we have seen the draft of the next examination. And in this final gazette, which is released just yesterday, there is not much more change in the draft and this gadget. This is the Gazette of India, which is released yesterday on 28 June. As stated in the draft, there will be two types of next, next one, and next two. In next step one, it is a theory examination which having one or more than multiple choice questions and which is the computer based online mode of the examination. These are the subjects and pattern of examination. There will be 6 papers in next step 1. That is the first will be medicine and allied subjects of the 120 attempts of 3 hours duration paper. Second paper will be surgery and allied of 120 attempts with 3 hours duration. Obstetric and gynecology of 120 attempts with 3 hours duration. That means medicine, surgery, allied with obstetric and gynec will be of 120 attempts with 3 hours duration each. Whereas pediatric, ENT, and ophthalmology will be 60 attempts of 1.5 hours duration. The proposed schedule of the next one on the day one, there will be medicine and allied subjects of 3 hours duration, and after that, there will be 2 hours break, and subsequently on the same day, after 2 hours break, there will be 1.5 hours pediatric subject. On next day, there will be rest day. Then on third day, there will be 3 hours duration surgery and allied subjects. And after 2 hours gap, there will be 1.5 hours ENT subject. Again on fourth day, there will be rest, no examination. And on the fifth day, 3 hours duration, there will be obstetric and gynec subject. And after that, 2 hours of rest, there will be ophthalmology subjects of 1.5 hours. This is the tentative subject. That means on the day one, medicine and pediatrics, 4.5 hours duration, surgery and ENT of 4.5 hours duration, and obstetric gynecology and ophthalmology of 4.5 hours duration. The exam will be for 5 days, but actually the papers will be for 3 days. This is step one. Computer based MCQ questions will be conducted by AIIMS Delhi. The Commission will specify the regulations and by notifications the manner of conducting common counseling by the designated authority for admission to the postgraduate broad specialty seats in medical institution. The Government of India will decide and notify the agency of counseling of all the PG admission seats. Remember this next that all those students who have completed the third M.B.B.S or final M.B.B.S course from a medical college which is approved and recognized by the commission shall be eligible to appear for this examination. This is the eligibility criteria to appear in the next one examination. NMC approved colleges only students can give this exam. There shall be regular next step one examination which is held twice a year in the month of May and November, or which will be notified by the commission. This is very important that next step one will be twice, it will be conducted in the month of May and November. There is no restriction in the number of attempts to appear in next step one. It is very important thing that next step one will be can be given multiple times. But remember that this is the warning line that every candidate has to complete his M.B.B.S course next step 1 and next step 2 within 10 years of joining this M.B.B.S course. Though it is not mentioned that first M.B.B.S has a 4 attempts. Once you complete that 4 attempts and you could not pass first year, there will be exit. And again after the 10 years, if you couldn't complete this M.B.B.S course, next 1 and next 2 phase of examination, there will be exit will be there. Next, very important thing that there is no restriction to the number of attempts to appear in next step 1 examination. Repeat exam can be given to improve the scores, but again there is one warning. Examination to improve the scores provided these examination for improvement of score are taken after completion of next step 2. That means if you want to improve your score in step 1, because which is the score which is counted for the PG admission, but simultaneously you have to pass or fail the next step 2. Candidate is not entitled to appear in next step 1 for improvement of the score till completion of next 2. It is very clear, if anybody wants to improve his score in the next step 1 examination, he has to clear the next step 2 exam also. Next step 1 shall replace the conventional university or institutional theory examination of third M.B.B.S and final M.B.B.S part 2 exam. But third M.B.B.S oblique final M.B.B.S part 1 and third M.B.B.S final M.B.B.S part 2 practical and clinical examination shall continue to be held conventionally unless otherwise notified by the commission. This is very important thing. Every student should remember that the exam which you are giving after the third major theory exam will not be there. Like till today, we are giving the medicine, surgery, pediatric, gynae, ENT, ophthalm examination. That exam, theory exam will not be there, but practical, which is conducted by the university or clinical examination, that will be conducted as per regular schedule unless and until it is notified by the commission. That means you should be prepared for practical examination conducted by our respective university. This is about the next one exam. Now next step 2 exam, which is totally practical and or clinical and viva voce examination, covering 7 clinical subjects which are mentioned in the step 1 also: medicine and allieds, surgery and allieds, obstetric and gynecology, pediatrics, ENT, ophthalmology, orthopedics, and recently included department, that is the rehabilitation and physical medicine, PMR department. These 7 subjects: objective structured, clinical case based, simulated cases, and patients, aimed at evaluating practical and clinical skills, clinical decision making, and communication skill expected of an Indian medical graduate. The examination shall be held in person and shall be conducted by the respective state health universities, public institutions, following the standards and guidelines provided by the commission. That means next step 2 examination, which includes the 7 subjects just I have told, it will be OSCE OSPI simulator based or actual patient based clinical decision making and communication skill expected exam, which will be conducted by the respective health universities. It's still not clear whether university will conduct this examination at the college level or they will make the zonal centers for this step 2 examination. There shall be a regular next step 2 examination twice a year. Like step 1, that exam was also twice a year, this is also twice a year. A next step 2 supplementary examination shall be held twice a year and is restricted to only those candidates who have failed in one or more of the 7 subjects and are required to repeat the subject. It is very important thing. And if a candidate fails in more than 3 subjects, he or she must appear in all 7 subjects afresh in a supplementary examination. Suppose candidate has passed step 1 examination, now he has done the internship, then he has to take the next step 2 examination, which is OSCE, OSPI based, simulator based or actual patient based examination in the 7 subjects. And he has to clear each and every subject. If he fails more than 3 subjects, he has to appear all the 7 subjects as a fresh candidate in the next supplementary examination. I think this is very clear that he has to pass all the subjects, and if he fails more than 3 subjects, then ultimately he will appear as a fresh candidate in next examination. And remember that next 2 exam will be conducted twice in a year. Here also, like step 1, there is no restriction to the number of attempts to appear in next step 2, provided the candidate has passed next step 1 and next step 2 examination within 10 years of joining the M.B.B.S course. This is very important thing that every student who is taking the admission in the M.B.B.S, he should know that he has to complete the course of the M.B.B.S within 10 years, including next step 1 and step 2. The marks in step 1 shall be calculated as a whole number, which shall serve as a raw score with appropriate decimals and subsequently corresponding percentage. Marks out of maximum 100 with appropriate decimals may be calculated if required. That means it is the full marks will be calculated, not decimals, but if required, they can calculate the decimal also. Next two examination results shall be declared as only pass and fail based on the acquisition of appropriate competence that is being evaluated. In the last video, I have made very clear. Next step 1 is the quantitative exam where the marks will be given which are applicable for the taking the PG admission. Whereas next 2 is the qualitative type of examination which can only indicate pass or a fail. That marks will not help to get the admission in the post graduation. For the next step 1, in which there are 6 papers, every student has to secure minimum 50% of the marks. But remember, this is the scoring examination. This minimum 50% is just the passing criteria, and the score will get the decide the admission for the PG. Suppose candidate A has scored minimum passing marks in 2 subjects and failed in 4 subjects out of 6. He or she can appear in next exam cycle of next step 1, and if he or she has scored the minimum passing marks in rest 4 subjects, then he or she will be considered to have fulfilled the above criteria. Second example, candidate A has scored minimum passing marks in 2 subjects and failed in 4 subjects. He or she can appear in next exam cycle of next step 1, and if he or she has scored the minimum passing marks in 2 subjects, then she has to appear in next exam cycle of 1, and if she has scored the minimum passing marks in remaining 2 subjects, then she will be considered to have fulfilled the above criteria. So getting the 50% minimum score is the eligibility for this next exam. For the purpose of determining merit for admission to broad specialty, that is the PG, the total sum in the next one will be calculated. And it is very important, for determining merit for admission to this PG, step 1 score shall remain valid for 5 years. That every student should know that next step 1 score, after clearing the next 2 also, next 1 score is valid for 5 years. So on the basis of next step 1, candidate can take admission for next 5 years. However, if candidate is appeared in next exam step 1, then previous next step 1 score would be invalid for determination of rank of admission into PG courses. If any candidate wants to improve his score in the next step 1, after clearing next step 2, he has decided again to give the next step 1 to improve the score. Whatever score he gets in the last examination, that will be applicable to take the admission in PG. That score may be more or less, but last exam score will be calculated. To determine the rank for admission into PG course in broad specialties in an academic year, the candidate needs to apply generation of rank in a manner as prescribed by the commission time to time. If any candidate has given next 1 and next 2 exam and he has not given application for the generation of rank, he is not eligible to get the admission for the postgraduate course. So he has to again apply for generation of rank to get the PG admission. This is very important. How to do the generation of rank? The normalized sum of raw scores obtained in each paper or a subject in a single next step examination 1. Step 1 exam cycle will be notified as and when necessary by the commission. Candidate with lower attempts of the next step 1 will be given higher ranking, because some candidates will give multiple attempts to improve his score, and one candidate who has given the only one attempt, whatever his score, he will get the priority. So number of attempts will give the adverse reaction in the admission of the PG courses. So one has to be careful whenever he is thinking the new attempt to give for next one exam to improve his score. Candidates with higher marks in the following order of preference will be given higher rank. First, medicine and allied. Second, surgery and allied. third OBGY, fourth pediatrics, fifth ENT, and sixth ophthalmology. So this is the chronological order of the preference of postgraduate admission. One important thing from this slide you have to take that lower attempts of the next step one will be given higher rank. This is about the compulsory internship regulation. Every candidate who has passed the 6 theory papers of the next step 1 as provided by the NMC guidelines in the section 2.3.2 and he has passed third M.B.B.S final part 2 examination, that is practical or a clinical examination conducted by the respective university, he is eligible to for the internship rotation program. So these are the two eligibility criteria. Step 1 he has to clear, and concerning MUHS practical examination he has to also pass. This is just tentative schedule of this year. They are mentioned given in this gadget. Step 1 examination will be either in the May and November. Result will be within 1 month of the exam, that is June and December. Third M.B.B.S, that is the final M.B.B.S part 2 practical and clinical university exam, will be first week of June or December according to the schedule, and result will be 2 weeks later on. Then immediately after clearing the step 1 examination, internship will start. Then completion of the internship, next step 2 exam will be there. After 6 months supplementary exam will be there, and PG admission will be there as per the counseling rotation. This about the new gadget which I have just told. Now the mock test which is going to conduct by NMC, and this responsibility they are given to the AIIMS New Delhi. AIIMS New Delhi is the sole authority for the conduct of all aspects related to mock or practice tests such as application, conduct of exam and declaration of scores. All disputes regarding this exam will be in the jurisdiction of the Delhi court. To appear for this mock test, eligibility is the final year students of 2019 batch who are pursuing M.B.B.S course in the medical college or institution in the India. Open candidates and OBC candidate has to pay the 2000 rupees. SC, ST, EWS they have to pay the 1000 rupees, and remaining benchmarks with disability they have to no need to pay the fees. This is regarding the mock test fee which they have to put on the while putting the application. Mode and scheme of examination for this mock test. There will be two papers. First will be of 3 hours duration, 9 a.m. to 12 noon. Second will be 3.5 duration, 2:30 to 6 p.m. This paper will go. First paper will be 3 hours duration of 9 a.m. to 12 midday. 120 questions will be there from the medicine and allied subjects, including pediatrics, ophthalmology, including all aspects of these subjects covered under first, second, and third M.B.B.S course. It will be MCQ based question with single correction option. Correct answer will be given 1 mark. Paper 2 will be 3.5 hours with 140 questions, surgery and allied subjects, obstetric and gynec, ENT, including applied aspects, these subjects covered under first, second, and third M.B.B.S course. Again, this will be multiple choice questions, carries the 1 mark. Here, one thing they have mentioned about the mock test, that incorrect answer will deduct 1/4 of the mark in paper 1 and paper 2. But they are not specified in the Gazette which is published just yesterday whether the actual next one in that there will be negative scoring or not. But in this mock test, they are very specifically mentioned incorrect answer will deduct the 1/4, that is 25% of the marks. This is a loophole which we have to clarify in the subsequent correspondence with the NMC and AIIMS Delhi. But till today, we have to keep in mind while answering the questions. Mock or practice test will be conducted on 28th of July of this month. Paper 1 will be just I have told 9 to 12, and paper 2 will be 2:30 to 6 p.m. Kindly refer to important dates which just given below. Last date for online registration of basic candidate information on AIIMS website is the 10 July 2023 by 5 p.m. Every student of the 2019 batch who is in the third major, they should go on the AIIMS Delhi website, not NMC, before 10th of the July to do the registration. Registration is going to start just immediately on 28th of June and it will be up to 5 p.m. on the 10th of the July. Then the status of registration and basic candidate information and correction of rejected images will start from 11th of July, and the window will close by 12th of July by 5 p.m. This is also very important date. And final registration and basic candidate information acceptance will be up to 30th July up to 5 p.m. So you have to keep in mind 10 July, 28th June to 10 July, 11 to 12 July, and 13 July. Generation of exam Unicode will be done once the application from the candidate is accepted on 28th June to 14th July by 5 p.m. Then submission of certificate, especially for other things, will be from 28th of June to 21st of July. Admit card you can download on 21st of July and actual test on the Friday 28th July. Candidate score will be declared very soon once the completion of exam. So now every candidate has to start searching the website of the AIIMS Delhi. For any queries relating to next exam, they are given the specific address, that is the Assistant Control Exam Examination section of the AIIMS, Ansari Nagar, New Delhi. There is a toll-free number also, and timing they are mentioned Monday to Friday 9:30 to 5 p.m. and on Saturday 9:30 a.m. to 1 p.m. And this is the website next.aimsexams.ac.in. So in summarize, next one and next two exam will be 6 monthly duration starting from 2019 batch, those who are in the third major. Both the exam will be conducted as per the guidelines. Next one will be conducted by AIIMS, that is the MCQ based examination. Next two will be conducted by the university. One important thing that regular theory exam of the third major M.B.B.S will be replaced with this next exam, and clinical or practical exam will be conducted as per the regular guidelines till further notification will come. Highest score of the next one after completing next two exam will be calculated for the PG admission. But those students has a multiple attempts and more attempts, their priority will be lowered as compared to first or a second attempts. So next one score will give you the PG admission. After internship completion, you have to give the next two exam, and that is the just pass or fail exam. After that, one can take the PG admission. This is about the in short about the next exam. Kindly refer the previous video of the next exam where all details of the theory and practical is given. Thank you.